Good morning, welcome to the Alpha Female Lounge on Asake Online. My name is Pamela Mpofu and I'm your host. On the show we discuss a wide variety of issues that young women in Matabeleland continue to face. Today we delve into the issue of gynecological health issues for young women. And in the studio joining us today is specialist obstetrician and gynecologist Dr. Ellen Hondoga. Dr. Ellen, welcome to the show.
Thank you, Pamela.
We're glad to have you on the show. Dr. Ellen is also the founder of Female Health Trust Initiative, an NGO that focuses on, but is not limited to, reproductive and sexual health issues of women and the girl child. Dr. Ellen, before we go further into the discussion today, can you please outline what your job as an obstetrician and gynecologist is with relation to women?
Okay, that's a huge chunk to bite. However, I'll try to summarize it. Gynecological, it has to do with mainly the female reproductive system and their problems. And we have also emergency cases and cold cases in that field respect. When I talk about emergency cases, that are ectopic pregnancies, where patients may come when they've started to bleed internally, when they've ruptured their tubes from a pregnancy that is situated in an abnormal area. Then we have the cold cases, let's say mainly in the clinics. You can meet women with sexually transmitted infections or PID or bleeding disorders. Then obstetric is more of the pregnant woman, okay, her health and her baby, okay. Itself has also got its emergency side of things and just a normal pregnancy or an abnormal pregnancy. So it's quite an interesting field where one day you can be walking in your heels and another day you're really running to save a patient and probably with a baby as well.
All right, thank you so much for that. Okay, so over the past 3 decades, we've seen that the health system has continued to suffer in the country, particularly with regards to having resources to provide adequate health supply. Looking at diseases like HIV and TB that are given top priority because of the seriousness. Do you believe that female health issues are given as the priority that it deserves?
I think it is. We have a dedicated clinic for female health, and it doesn't only look at older women. It looks right from the young, the adolescents, or the youth, as you may say, right to the elderly women. And I think government, in partnership with different organizations, have been trying to do their best. Being a third world country, we have many burdens, and our focus is on life-saving. So it might seem that some part of female health might not be prioritized, but they are. We have organizations that are focusing on family planning, which in the ultimate will reduce maternal morbidity or mortality as well. And we know that the issues to do with breast cancer and cervical cancer, which is a burden for Zimbabwe being in the third world, and it's the major cause of death, cancer related in females. And a huge initiative, huge money is put, budgets to make sure that a woman doesn't die from such. So I think female health is being prioritized in its due respect.
Okay. So young women, usually particularly the age of 18 to 25, they experience some menstrual disorders like menstrual cycle irregularities, abnormal uterine bleeding, and heavy menstrual bleeding. How does one know when this is an issue that I need to go to the clinic to? Because sometimes we may overlook it and think it's just a regular flow. I'm just like that.
Good question, Pamela. I'll just give you an example. When you're going through your daily routines and then you suddenly have a headache. Is that normal? So you've like moved away from your normal. So I think women should just take the initiative when you suspect, when you've got that intuition, that suspicion that this is no longer my normal. You seek for advice, okay? But just to add on to what you said, the whole irregular bleeding or the heavy bleeding is all a parade of what we call abnormal uterine bleeding, okay? And so with community, some might be shy to come forth. But when you see from your usual pattern of your menses, you've changed. You used to have probably a 4-day flow, and you're going 7 days a week or 2. That's totally not normal. Okay. When a woman is supposed to bleed once per cycle. Okay. So if you see yourself bleeding twice or thrice in a month, that is abnormal. You need to seek medical care. When women usually have what is known as period pain, to the layman, we call it dysmenorrhea, okay? And there is the normal kind of dysmenorrhea and then the abnormal kind of dysmenorrhea. So if a person who usually has pain, which is fairly bearable, not affecting your daily routine, you do seek medical care, probably for just some analgesia and psychological support. But if it's affecting your schoolwork, affecting your work, you're missing days of work, it becomes an issue of concern. And if the pain is continuing right through the period and after you finish the period, that becomes an abnormal pain. It should be just maybe a day before your period, and it ends a few days during your period. So if that continues, then it's a cause of alarm, not to just sit and say, no, I'm a person who has pain all the time, okay? And if you start feeling dizzy, okay, women have different flows. Some might pass in clots. Some might be anemic. Just a little flow might disturb their dynamics, okay? So if you start having headaches, feeling dizzy, feeling your heart racing, headache, so you're probably losing a lot of blood. So you need to seek medical attention.
Okay, while we're still on the issue of menstrual cycles, a large population of young girls are not able to afford proper sanitary, and that puts them at a high risk as they end up using other alternatives, for example, newspapers and cow dung. May you kindly highlight some of the risks that they face by using these other alternatives?
Okay, thank you. It's quite unfortunate, but a true reality. However, the use of such, the female reproductive system is very sensitive, okay? So if you put anything foreign that can cause infection or bruises or abrasions, it can have problems in the long run. And the major problems of concern are infections, okay? Different infections from whatever is cultured in that dung, okay, that can start affecting you, and you start having itchiness, discharges or ulcers that can end up as the package of the infections. We can also end up with malignancies, which is cancer, okay? That is a cause of concern. We have cancers right from the outside, which is called vulva cancer, okay? And going inside the vagina right to the cervix, okay? So you can have vulva cancer, vagina cancer, cervical cancer. Now, these are not like the habitants or of the bug or the germ that usually causes these cancers we see, but they make you at risk due to the infection and the abrasions that follows after using these things. So if you change your normal, like the vagina has got its normal settings, normal bacteria, normal or bugs that are supposed to be found there, okay? So if you insert things or if you use things that are not friendly, they disturb that environment. Once that environment is disturbed, you're prone to infections. If you get ulcers, there is what is known as human papillomavirus, especially for the women who are sexually active. That's an easier way for that virus to track in and eventually cause cancer in the long run. So the use of such is quite discouraged due to the infections and the cancers that may follow.
Okay, thank you. And before we move on to something else, can you just kindly highlight, Uti, how long does one wear a sanitary pad? Because you'll find that people will say, because I have a different flow, I can wear this pad for about 6 hours because my flow is light. And others with heavier flows obviously will feel the need to change because of their flows. But regularly, what is the correct time for someone to change their pad?
Okay, that is quite subjective. Like you've rightly mentioned, that some flows are different, okay? Flows are different, women are different. Our body habitus is different. Some are slim, some are really big, okay? And you might even just start sweating just with one pad and low flow, okay? So I would want to run away from giving a stipulated time, okay? However, if a woman is uncomfortable with her pad and you feel you need to change it, it's fair and fine. Some are just hygiene freaks, you know. Some women are just hygiene freaks. Even a normal discharge will just freak that woman out, okay? So she might change it after 2 hours, okay? She might change it after 3 hours when there is no flow. And then you find someone who's got a heavy flow, but because of finances, she's stuck to one pad, which is now heavily soaked, which predisposes to infection, abrasions, bruising, and all that, the usual discomfort of that pad, but just because she can't afford. So she would need to change it regularly as minute as she feels that it is fairly soaked or used up. Then, so I can't say 2 hours, I can't say 3 hours, you understand? The minute a woman is feeling uncomfortable, if finances permit, so be it, do your 2 hourly. But if finances are limited, but you don't have to push the whole day with one pad, because that will give you problems and it will soak out eventually anyway. So there's no stipulated time we could really go for. I've kept you with what they say.
Okay, that's fair enough. That's fair enough. Okay, so one of the other female health issues that are common, particularly in this region, if you're looking at Matabeleland, are yeast infections. And there will be so much myths as to how you got it, what are the causes, and how you can prevent it. Can you give us the proper preventative measures, if there are any, and what causes yeast infection?
Okay, with yeast infection, it's quite tricky. I get a number of patients as well who might get an yeast infection and they think it's a sexually transmitted infection. So it's more not of a sexually transmitted infection, okay, but there are problems when we end up treating the partner, okay. So the main cause, like I said, down there in the vagina, there are normal flora. We say normal germs that are supposed to be there. So when that balance is disturbed, we can end up with a yeast infection. And the common it's Candida, okay? It's Candida and it's got its own friends. There's the commonest, which is Candida albicans, okay? Now, there are women who are at risk of getting a Candida infection. So you find your pregnant women as usual because of the immune system that comes down, okay? And then HIV patients, okay, their immune system is also affected. Diabetes, okay? Yes. Women who are on renal failure and chronic dialysis. Women on chemotherapy, probably cancer. So anything that can bring your immune system down, okay, can predispose to yeast infections. That being said, there are practices as well that can disturb that milieu, okay? So dwatching, which is the aggressive habit that women have, thinking that I need to clean up the vagina, okay? It is not clean. Maybe daddy has been there or whatever, they feel they have to clean it up. So just like your ear, the vagina is self-cleaning. You don't need to push anything up. You don't need to push even the water up. You don't need to push soap or Dettol or betadine or whatever one might think needs to do to clean it up. It self-cleans. If it's after sexual intercourse, the sperms will come out by gravity. So that practice predisposes to yeast infection. Also, chronic, not changing your pads like we've talked in the previous question. If you keep your pads for too long, that warmth that can disturb the environment and you end up with yeast infections. Some women who use tampons, okay, might get prone to yeast infections. So if you find those ones who come recurrent with yeast infection, might need to change the method of when they're on their menses, okay? Women like nylon panties, okay, and the tight-fitting jeans, okay? But we're not all the same, again. So nylon, cotton is best to avoid yeast infection, especially if you're a person who's prone. And if you're a person of big habitus and you're sweating too much and there's too much disturbances, you might need to adjust your wardrobe, okay? The issues of newspapers or things being pushed up as well, that also predisposes to yeast infection. The bubble baths, okay? The bubble baths we like to use, or making fragrance down there, putting perfume, fragmented pads. Some women are prone to that as well. So people are different. So if you find yourself getting more of yeast infections, you might need to visit your practices as well.
All right, thank you so much. And then we have vulvovaginal candidiasis. I think you've mentioned it a bit. In Zimbabwe, it's mostly prone among young adult women. Can you just tell us why that is?
Okay, so apart from what I've said, okay, apart from what I've mentioned on practices, because vulvovagina is the same as vaginitis as well, caused by the same yeast infection. Okay, so young women, they like nylon, they like to doge, okay? So it's also, again, practices. And when you find it's more in the much younger age groups, that is the adolescents going down, it's more of hygiene as well, okay? So you find these girls, mostly maybe 7 years, 8 years, they don't know how to clean properly. So you find they might clean from back going frontwards instead of the proper way, front going backwards. So that infection that may come from behind may also predispose them to vaginitis, including yeast infections. Those that are sexually active, why I mentioned that we end up treating sometimes the partner, is you might be continuously having yeast infection, and when you meet up with your partner, there might continue to be that exchange. So we end up treating both your partner and yourself, but not to say it's an STI, like really, okay, but just to take care of that problem. Yeah.
All right. This is the Alpha Female Lounge on Asake Online. If you're just tuning in, today we're with Dr. Ellen and we are discussing all things female, hoping that you guys are following and you're learning a lot from today's program. Okay, so doctor, there's a lot of stigma, especially in our Black communities, when you start having these conversations, say even within families, to say, Mama, I'm having this, and it's sort of like taboo to talk about such things. How can we change the perspective to say that it's okay for us to talk about these things in the open?
Excellent question. Our problem is we're starting when they're far grown, you know. We're starting introducing them when they're at school. And like you said, it's a taboo at home. So we need to change our perspectives right from home, okay? The girl child, 3 years, as she's growing, we start talking to her about female health. A 3-year-old girl or boy is already aware of her or his reproductive system at that age. So even when they're bathing, they're empowered. They need to be empowered at that age. So if you start empowering the girl about herself at such a tender age, it will not be much of a problem when it's brought up in the community. So I feel we're bringing it late, and we're doing it secretively. So if they're taught together with the boy, with the, you know, making it an open discussion and helping the girl to be more comfortable in her skin, it becomes easier to discuss these issues and even to come for help. Like you've mentioned, there was a patient who was having her menses, okay? But just because of this lack of communication in the family or in the household, she was brought as a victim of sexual assault, okay? Where they said, ooh, she's bleeding, somebody should have abused her. But on asking the child, she was just having a period. So you see, we really have problems right at the home. So if we start to educate our children at home and the parents start to have a different mindset, towards health issues regarding the girl child, I think will go a long way.
Okay, so in a survey done by Zimstad in 2019, it showed that 10.9% of girls in Bulawayo, 29.4% in Matabele North, and 20.3% in Mite South are married by the age of 18. And most of these girls, when they get married, it's not that they're doing it voluntarily, it's mostly child marriages and all. And this will obviously increase the high need for family planning services. And most of them just do it because my friend got Jadel, I'm going to get Jadel. My friend got this. So how does one know, even if there are those who prefer to have family planning before they even have kids, how does one know which one is okay for me and which one is not okay?
Thank you for the question. I think they should just go to the health centers, okay? We've got clinics, we've got hospitals. Like at the central hospitals, we have dedicated clinics for the youths, which we term youth-friendly clinics, where issues on reproductive health, even family planning, are discussed. So you've rightly mentioned that no one method fits everybody. So by attending such clinics and getting such education, they're able to choose which method best suits them. Some might have recurrent infections, even the same history of sexually transmitted infections. Some might have cardiac disease. Some are diabetic. Some are hypertensive. And there are methods that we cannot use for those. Okay. So if they do come and a history and a discussion takes precedence, then they are directed to the proper method to use.
Okay, thank you. And also, you're the founder, like we mentioned earlier, that you're the founder of Female Health Initiative Trust. Can you kindly just take us through what you guys do there? Okay,
so it's in its infancy. We still do my programs or projects. However, its focus, it's mainly on the female, okay? Right from the tender age to the elderly, the go-go's, okay? So it leaves no stone unturned. Why I say that, its focus is holistic in approach. We don't focus only on reproductive health. We don't focus only on cancers. We don't focus on breast only, okay? It's the whole woman, okay? Now, when I say the whole woman, it has to do with her mind, her spiritual, her physical body, her emotions, everything. I feel the world or the nation is healthy when the woman is healthy. If a woman is depressed, she will not take care of her family well. So even if her husband is not well or her child is not well, female health is there as well, because we need to take care of that problem of hers so that she's more functional in the community. So Female Health Initiative it has that holistic approach on female health. Anything or any issue that can come to your mind that concerns female health, we are there.
Okay, thank you so much for that. And before we wrap up on the show, are there any healthcare tips, particularly hygiene practices, that young women can practice just so that they don't get these other infections that we may be able to avoid?
Okay. Health tips, let's start with our minds as women. Let's love ourselves. Let's feel good about ourselves, about our bodies, you know. We have a lot of issues going, a lot of hormones circulating. I always talk about the estrogen hormone. It's a nightmare, but if we start there by correcting our minds and loving ourselves. Eating healthy, okay? Eating healthy fruits and vegetables, okay? Not always the fast foods, because that predisposes us to so much problems. Avoiding dosing, okay? Insertion of things or herbs. Prophets tell you to put lemons. Avoiding all those practices when it comes to our health. Seeking advice from the experts, going to the health center to find health aspect, education rather than from social media or from Facebook that is not authentic, will end up in problems. Sexually active women, I advise them to condomize, okay, to know their status, and to take care of each other. Love your partner, and loving your partner also comprises you taking a step ahead to protecting your partner. So in encouraging healthy sexual practices. Yeah.
Okay, thank you so much for that, Doc, and thank you so much for coming onto the program. That was very informative indeed, and we're hoping that all of your viewers are going to learn something from the show. That's all we had for you today on the Alpha Female Lounge. We're talking all things female health, and if you have any questions regarding this particular episode, you can leave down in the comment section below, and then our doctor will come back to you again with the answers to your questions. Don't forget, you can always follow the conversation on our social media pages, on Instagram, on Twitter, as well as on Facebook. From me and the team behind the scenes, until next week, goodbye.